There are multiple ways cancer can lead to death. The most dangerous forms are metastatic, where a single cell detaches, travels, and forms a new tumor elsewhere. That tumor can invade any organ and stop it from working properly. In general, if cancer overtakes an organ that carries out a vital function, it can be fatal. For instance, if a tumor develops in part of the digestive tract, it may interfere with breaking down food and absorbing nutrients. It can also obstruct the passage of waste and cause a rupture which becomes deadly without surgical treatment. Another case is blockage of the pancreatic ducts. This results in the pancreas essentially digesting its own tissue. Pancreatic cancer is known as one of the most painful and aggressive cancers. If cancer spreads to the lungs, there may not be enough healthy lung tissue left to take in oxygen into the body. In such situations, patients can die from suffocation, which is the leading cause of death in lung cancer. The next most common cause is infection. Having cancer weakens the immune system, and chemotherapy makes it worse by reducing bone marrow function, which is responsible for producing white blood cells. This helps explain why infections are particularly dangerous for cancer patients. Bone marrow function can be damaged not just by chemotherapy, but also by cancer cells invading it. When cancer spreads into the bone marrow, it eventually reduces the body's ability to produce enough healthy blood cells. This leads to several effects. First, it causes anemia, meaning less oxygen is delivered throughout the body. Second, it lowers white blood cell levels, which are needed to fight infections, making it harder to control bacteria. And third, it reduces platelets, which are necessary for stopping abnormal bleeding. Since major organs are essential for survival, they are also difficult to operate on. Even if surgery is successful and the tumor is removed without harming the organ, it can still return because only a few remaining cancer cells are enough to restart growth. This is why combining surgery with chemotherapy is often necessary for treatment. Aside from organ failure, cancer patients may also experience severe weight loss known as cachexia. This happens due to substances released by cancer cells that reduce appetite and disrupt digestion, causing rapid loss of weight and muscle. Cachexia is believed to affect about half of all cancer patients and is thought to directly contribute to up to 30% of cancer-related deaths due to heart or breathing failure linked to muscle loss. It is also responsible for around half of deaths in patients with cancers of the digestive system and up to 80% in those with advanced pancreatic cancer. Many treatments can manage cancer for long periods, but if it keeps progressing, it may eventually overwhelm the body and treatments may no longer be effective. At that stage, the focus may shift toward comfort and improving quality of life. It is important to understand that effective pain management exists, and no cancer patient should have to die in pain. You may have heard that using strong drugs like morphine can speed up death. However, specialists confirm that opioids play a crucial role in easing suffering and can even extend a patient's life. Watch my next video if you want to learn more about this.